No.
Ready to start? I don't need to be introduced myself. Never missed one.
Thank you for coming to the MHA Roundtable. Andrew O'Grady is going to be our moderator. Yeah. Woohoo! Thank you for coming, and our panel. Andrew's going to introduce our panel.
Thank you. Thank you.
Please silence your phones.
First, I want to have a little disclaimer. It should only take about 30 seconds. I had surgery on my C3 through C7 discs, my neck. They go in through the front. They paralyzed my vocal cord in the process. So that's why I sound like this. But if I'm talking very slowly and quietly and into this mic, it's fine. But I won't be hanging out afterwards because nobody can hear a thing I say. I'm all air. I'm sorry. So anyway, we have a great panel tonight, and we're going through some interesting times in our world and in our country and in our state and in our communities. And I can speak from a not-for-profit perspective. It's tough. Every day we get a new email saying that things are cut. I don't want this to be about it's going to be like the elephant in a room, honestly. I mean, we're at a time where we're dealing with things because of the people that are in power, but they got voted there, and our country maybe needs a shift or a change or whatever it is, and we're going through it, and we can't control it. So, it's not about bashing what's happening, that the people that are in charge of making it happen. It's just about how are we navigating it, how are we dealing with it, how are we acknowledging the stress that's being caused on people, and what do we do about it? So we have a great panel today, and I'm going to ask them to introduce themselves, and I would introduce you, but I'm going to try to save my voice. We'll just go right down the line and who they are, where they work, and what their expertise is, and then we'll get into some questions.
Hi, everyone. My name is Karen Martyr. I use she, her pronouns, and I am the executive director and one of the co-founders of Dutchess County Pride Center.
I'm Wendy Freedman. I'm a clinical psychologist, and I'm a director of the Vassar College Counseling Service. I've been in the field of mental health for about 22 years, most of that in college mental health.
Hi, my name is Amy Novatt. I'm a board-certified OB-GYN, and I've been practicing mostly gynecology for about 32 years. I currently work as a consultant. I am no longer working in corporate medicine, and very thrilled to say that out loud. And I'm also the creator and host of a podcast called GynoCurious that discusses all aspects of women's health, both from the perspective of healers as well as those who've been healed.
Hi, my name is Eric Garnica Aguilar, board certified psychology and psychoanalysis. I currently work at Mental Health America at Dutchess County as a language specialist care manager. And also I run my private practice, specific work with people who speak Spanish. And I have 12 years in experience. And before I come in this country, I was a professor in Oaxaca, Mexico, when I am original from there. Thank you for having me.
My role is the CEO of MHA of Dutchess County, and our partnership with Radio Woodstock has been fantastic. A lot of radio stations look to, get us to be on their station, put commercials up, and it's usually, here's your money and we'll run a commercial. And only one station that says, we'll take your money, we'll run your commercials, but we really want to do something with you for the community. And so kudos to Radio Woodstock, and thank you for doing this. This is really great. So maybe we'll just start with, who wants to talk about some of the challenges that they're seeing right now for the people that they serve? Maybe you want to just chime in a little bit.
Maybe I want to start. Maybe I don't.
You have to start. I want to put you on the spot.
No, I'm just being silly. I use humor as a coping mechanism. That is actually my biggest advice for everybody is use humor. No, but, for the LGBTQ plus community, particularly for trans folks, it is a really scary time. There are, again, not to get too political, but there are constant attacks against the queer community and the LGBT plus community right now, and particularly for trans folks. I work with a lot of young people. I work with a lot of teenagers, and they're scared. I've worked with teenagers my entire career. I've been doing this longer than I want to admit, but I've never seen teenagers just feel this hopeless about their future. And, it's hard for me as a clinician and as a mom of young people to, figure out how to help them through that. Because, feeling hopeless about your future at the age of 16, that's a really horrible way for a kid to feel. So I think that is one of the things that is really impacting our youth, is just this idea of, and they have no control over it, so they're also feeling really helpless. At least we all got to vote, and whether we voted for the guy who won or not, we at least got to have a voice, but they really feel that they don't even have that voice to speak on, what's happening to them.
What strikes me about that the most, to me, is that, I feel like this country has made, to me, it's strides, but we were moving in a direction that made it okay for people to be who they were. And people started feeling comfortable and okay to be themselves. And I can speak, I'll tell you that my kids are older now, but even that generation and generation after that are very accepting. Nothing like I was in my generation. It wasn't that way. I am ashamed of myself back then, but that's the way it was. But people are very, very good and accepting. And we got to a point where people started feeling comfortable about who they were, their sexuality, and accepted. And now, it feels like the door to bigotry is wide open, and it's okay to be that. So all those people that were putting it to the side and being politically correct for whatever reason, they weren't hurting anybody by being quiet, but now they feel like they can just say and do whatever they want, and they have the door to do that, and it is scary, and I feel horrible for those young people who are trying to navigate their way.
Yeah, absolutely.
Just to add a little bit to the research side of that, the Center for Collegiate Mental Health looked at and studied for young people who are dealing with facing discrimination, how it impacts their mental health. And they found that for young people who had 2 or more experiences of discrimination over the past 6 months were showing the same levels of emotional distress as students who had dealt with suicidality, self-injury, like very serious mental health issues. So the mental health impact is so significant for facing discrimination and bias. Yeah.
What are you seeing on a college campus more than that, above and beyond?
Yeah, well, it's an interesting time. You might have been reading or seeing in the media that there's been sort of a general increase across mental health issues for young adults in colleges, universities across the country. This has been happening for 5 to 10 years. This is not a new phenomenon where students are just navigating more severe and acute mental health concerns, which for a whole host of reasons we can talk about. But you can imagine that was already the trend. And then for young adults who are feeling that parts of themselves and who they are, who they're discovering that they are not accepted, where they're feeling at risk or at danger, you can only imagine how that's exacerbating the mental health struggles that they're already having. So what we're seeing is, already high levels of anxiety and depression and other mental health concerns. And now with the sort of uncertainty that Karen was speaking, like just this not knowing and fear, it really, we're seeing just a more acute state for that. And what I'd say is really, and I don't think this is just for the young adults, I see this even for the other people in my life, this sense of overwhelm and flooding, where folks are trying to figure out how to manage the amount of information and constantly changing environment that they're in. And I'm seeing the range from a lot of compartmentalizing, like I'm only going to look at what's happening right ahead of me and try not to think about that, which takes a tremendous amount of energy to continue to try to just live your day-to-day life and not think about that, or an immersion and hyper-focus on it where people are just being flooded and everything in between. And again, for different groups holding different impacts from the identities they have and how directly they are at threat, that's part of that too. And I think that uncertainty really leads to anxiety. People are really struggling to focus and then are really blaming themselves for that, as opposed to recognizing how could they in this environment, when they're getting this impact. Of course they're feeling impacted by that. That's a really normal and understandable reaction to have.
Dr. Novatt. Should I Amy or Dr. Novatt?
Yes, please, Amy.
Okay, Amy.
So, I just want to put it out there that healthcare is not just personal, that it's always cultural, it's always systemic, and it's deeply gendered and has been gendered forever. And I guess if the question is if I'm seeing more mental health issues in my office, I'd say yes. That women have always shared with me their concerns, fears, and worries, but the level of those issues is just heightened. And more anxiety, more depression, more feelings of not knowing how to cope. And I prefaced as I did because it's not just kind of on a personal level of what access do I have or not have to healthcare, but how is it affecting all the persons around me who identify as women, and policy changes that are affecting access and agency and the capacity to seek wellness. And this is a basic right that all folks should have, and yet people are feeling at risk, and for a variety of reasons, everything from sociocultural limitations, financial limitations, the constructs of systemic and kind of organized medicine that's just not really taking care of individuals anymore, whether you're a patient or a practitioner. So the whole system is really in a state of distress. So the answer is yes. I am certainly seeing more mental illness, emotional concern, and folks asking for help around not just their physical well-being, but certainly their emotional one.
I feel like there's we in this country should be going on a path that's kind of like this, moving in a direction. Hopefully it's in a positive direction, not like this and like this. That's what we're doing. I mean, we're not going, just as overall general, we're not going anywhere with infrastructure in this country. We're undoing everything the previous administration did. Every 4 years, something gets kicked back and we start over. And it's healthcare. It's a perfect example. That's what made me think of that. We haven't improved on, I call it Obamacare, Affordable Care Act. We made a major change. And did we take it and improve on it? Try to make it better for everybody? No. We just argued about it for 12 years and we're going nowhere.
It would be one thing if, as a high-resource country, we could be proud of terrific health care and that the general populace was a healthy one. But we rate extremely low with regards to overall well-being, healthcare, maternal and pediatric morbidity and mortality is extremely high, and then again access to care is just so limited for so many marginalized folks.
Yes, it is, and we're not a preventative society.
No.
That's why our outcomes are so bad, because we treat the outcome.
Well, if the basic tenet is that the sicker a community is, the more money you make, then one really has to question the mission statement and the incentives. It's a terrible conflict, and I know that many of my colleagues are really very distraught and concerned about how to stay true to the Hippocratic Oath and to stay true to their hopes and dreams for caring for folks in an environment that is really the antithesis of care. Yeah.
Eric, what are your thoughts on what your challenges you're seeing right now?
So definitely, we talk about the vulnerable groups, how difficult is seeking help in the system. I would like to talk about the immigration population. It's another vulnerable group. They have some like it's not kind of the same, but it's vulnerable group like the other group, like the people they have a mental health issues, the people the LGBTQ, and you know what I mean, the all the groups, and I would like to mention the drastic political, you know what I mean, ideas definitely make a hostile environment, and it's really hard for those people. But I would like to mention some ideas about the migration. When we talk about the migration, so automatic, we think in a stereotype, you know what I mean? But I would like share some ideas for deep understanding. What about this group, the immigration population? So basically, I classify that immigration for voluntary and forced immigration. For example, voluntary is about economic factors, education, family reunification. And forced immigration is seeking work, probably environment disaster, political unrest, asylum, refugee. But basically, those groups seeking opportunities, seeking better life. You know what I mean? But behind that search is a potential psychological problems. And in my practice, basically, mainly I identify 3 times the diagnosis is PTSD, anxiety, and depressed. Obviously, stress, but the stress no is a disorder because the stress is automatic answer that your body in one situation that you can handle is concrete situation or emotional. But I want to put a highlight right here in that diagnosis because I believe the diagnosis is only for the providers. It's only for the psychologist, you know what I mean? No, it's for the clients. So when I come right here in this country, I be surprised because the client have access to the diagnosis. I believe the diagnosis is reinforced a stigma. The stigma, when we put a diagnosis, we put a label. But that's really is interesting because when you put a label to the patients, you automatically you take a place like us, like healthy people, versus them, the sick people. So that's not right because that is discrimination. And I remember when I was in Mexico, and part of the discrimination was when I was my practice in Mexico. I was in a psychiatric agency. The psychiatric agency was, I remember, was 1 hour, 45 minutes away. You know what I mean? For the city, for the community. But that is a reflects how this society or how they discriminate that people. So we need to break that stigma as well.
I think the stigma has started to break in this country. Unfortunately, it's at the same time that there's not enough therapists and a lot of more people wanted to get help and are looking for help and they can't find it because there's not enough providers.
Yeah.
I think the stigma was worse in Mexico. So I guess the question I have for you, Eric, is how do we reduce the stigma for people who really find it a weakness to get help?
Yeah,
That's the stigma. They feel like it's a weakness to get it.
definitely the stigma is there, is real, even in the professional as well. Because I remember that I saw in that agency, the psychiatric agency, when was inpatient right there, and or the people take the therapy. I remember he finished the season therapy, go upside. She left a sweater. And the nurse take the sweatshirt, take like that, give it to me like. So I feel sad for that situation, because that's supposed to be, we are in the front of the line. So if you imagine if you have that stigma, so how you help that people?
Yeah, I have to say that I worked at, I don't want to put them out there, but let's say a local emergency room. And people would come in and they clearly had a mental health issue. I've actually called nurses out because they were like, oh, this one over here, or you see that, and it's in the professional world.
Yeah, see, I believe the answer to your question, I'm sorry, the answer to your question is, no, it's like go outside in the field, hug everybody, say love you, don't worry. No, I don't think so that it's going that direction. I think so going more like I wake up our consciousness about the social reality where we are.
Yes. Just to speak to that a little bit, I think we so much center the mental health struggle in the individual, that there's something wrong with you or how you're responding to it, and we're not looking at the fact that we're functioning in a system. And it's like if you had a fish that was swimming in a pond that was polluted and the fish started feeling sick, you wouldn't blame the fish for that, right? So of course, when you're in a system where you're dealing with stress and strains and toxicity around you, it's a human thing to be impacted by that. So if the more that we can destigmatize that it's not that there's something wrong with you, per se, you're dealing and coping with very difficult circumstances, and there are things that can be helpful to support you through that. I think that really goes a long way.
Yeah, words matter, and I wasn't going to call out specific people, but I listened to President Trump, and he says these crazies and these wackos, and using that language. I fought for 25 years, 30 years trying to get people to not use that language, because that's the language that further pushes stigma, and it's just not good. So it is a system thing. It's everybody around us, buying into that and feeling like it's okay to talk like that if you wanted to. It just muddies the pond and makes it worse. So, what are you seeing in the kids? You mainly work with kids or adults as well?
I work with both. My career has been spent working with youth, so I tend to gear towards them. And I run all the youth programming. We have other adults who run a lot of the adult programming, so I work mostly with the youth. But.
Are they feeling like, are you seeing a trend down in numbers because people are going back in the closet or hiding how they're truly feeling? Or
No, I don't think so yet. I don't know if that will change going forward, but I think right now one of the biggest ways to kind of help the community is to be in community together, is trying to find those opportunities to, be together and be with other people. When you're kind of, and Wendy, you were actually saying this earlier, is, when you're kind of experiencing this as a person by yourself and you're listening to all of this, it's so scary. But when you start looking at like, oh, there's 20 other people in this room with me and we're all kind of having the same experience and we're all having this fear and we all don't have the answers to these questions, but at least we can be here together. One of the other things that, we've been trying to do at the Pride Center is kind of run under this idea of the fact that joy is an act of resistance. If all this stuff is kind of hitting you and, you're living in fear, it's so hard to find joy. It's almost like they're trying to kind of take joy away from you. So having these moments of joy and having this fun, like tomorrow night we're doing a puppet making workshop. That's silly, that's goofy, that's just going to be a really silly time, but it's going to be a way for people to come together and, just be silly together. And, that's kind of one of the ways that we're trying to help the community is maintaining these moments of being together in a joyful way and not always being together in ways thinking of, fear and sadness.
So you're saying that an event like a puppet making event, some people think of it as a form of resistance.
Yeah, absolutely.
That's so sad.
It's having,
funny.
Living in this time when there are so many things that are, potentially really scary, being able to experience joy is sometimes really difficult. So, trying to create spaces where people are experiencing joy is a way of resisting what's going on in the world.
And just to speak to that, I think we can borrow from the wisdom of the generations and the elders who've come before us about that very thing that Karen's saying, that there have been generations of people from marginalized groups who've had to struggle with unbelievably difficult circumstances, right? If we think about the history in our country and in other places. And they somehow persevered and found resilience even in those moments by things like finding their joy and finding their community. I don't know the exact quote, but Audre Lorde talked about self-care as an act of resistance too. I think about the enslaved people in our country and how they survived that and how so much of that was around just the things that we're talking about, right? Joy, community, finding your resilience, even in the most difficult of circumstances.
Those are the things we should be doing. And I hear you, and it's a wonderful thing. I'm stuck on the resistance thing. It's so sad to me that even though they get joy out of being together and doing something, that they feel like they're fighting power by doing it. That's really sad to me.
But I think
it's powerful and healing, but sad.
I think some of that, people feel guilty about having joy when there's so much suffering. So I think by framing it that way, that it's an act of resistance, people realize that they're actually contributing to helping move things in a good direction by having joy, as opposed to letting down the communities who are suffering.
What she said.
I actually have Audre Lorde's quote here.
Perfect.
Quote, "Caring for myself is not self-indulgence. It is self-preservation, and that is an act of political warfare." So, there's also a woman, I apologize, I'm forgetting her name. She runs something called the NAP, N-A-P, like taking a nap ministry. And she's a Black woman who is really fighting kind of capitalism and white supremacy by saying, I'm going to bow out and I'm going to take a nap because I'm not going to just keep pushing and pushing and pushing myself and working beyond my capacity just for the sake of the bottom line, and often not my bottom line, but for them out there. And I just think it's a brilliant response, particularly vis-a-vis women's health care. Here's a woman who is saying, I am not only going to kind of stand up to what I feel like I need to resist, whether it's the patriarchy, misogyny, et cetera, but I'm also going I'm going to find a way that I can take care of myself. I'm going to take a nap. And in fact, there's great science that demonstrates sleep and napping is good for us. So I just think it's this brilliant, simple way of demonstrating resistance, awareness, and kind of empowering oneself and community with means of speaking out against all kinds of isms in new and creative ways. And yeah, it's a shame that we have to take these environments where we have pleasure and joy and music and art and have to use them as a means of resistance. But I'd like to suggest we've always done that, Our creative spirit has always been a part of every movement from time long ago. So I think that it's when we stop being creative, when we stop experiencing joy and passion and finding love in our lives, that's when we're really beat. That's when we're really, smushed to a pulp. So
that's what we want to avoid. We
Yeah.
want people to, if they're listening to this, hopefully we're going to get to a point where we're going to give you ideas and things you can do to not get to that point, not fall into that depressed state where you feel defeated and beaten and you don't want to try to get back up. And we don't want that to ever happen.
yeah.
We don't want anybody to go on a bridge at 3 a.m. and take pictures of Your Aurora Borealis. That's what Noelle did, but we're a little worried about her. Eric, did you have a thought?
Yeah, I think about, you know what I mean, we talk about looking or seeking what is the best way for the get a balance, you know what I mean, the mental health. I believe one way the community psychology think is about the pathologic, is about the system as well, not only biological mechanism to prepare to mental health. It's about the personal history, it's about the environment factors. So my point is that we are like a psychosocial, right now, but it's make the balance there. Mm-hmm. But I have some question right here. So if we are a biopsychosocial, so how many times we go to the primary doctor for check our body? So what is the recommendation? It's probably once a year. So how many times you go to the psychologist? Mm-hmm. You know? That is part of the stigma there as well. Why I don't need the psychology, or I know crazy, I don't have mental health issues. You know what I mean? That's not for me.
Well, people should take care of themselves in that way. There's not enough providers, but people should take care of themselves in all biopsychosocial ways. You need a social tribe around you. You need a social network.
Or how many times we have a crisis, we never go to the professional. We go to the friends. We go
to church.
We go to the father with the church. So we go, my father, my sister, but we never talk about with psychology.
I'm going to suggest that we stop using the word balance. I think it's balance. I think it's an elusive place. So maybe I'm just seeing it from a woman's lens, because balance means they're equal sides, and whether it's the weight of something or distribution of responsibilities. And I thought I was seeking balance for a long time, and then I finally said, it isn't going to happen. I mean, maybe a moment to moment, but in general, in my life, I'm always on one side or the other. I'm always up or down, and particularly if you're a parent or taking care of the elderly, it's, just day to day things change. So I'd love for us to come up with a different word, because I think that people suffer when they are looking for balance, and I don't think it exists. At least, I apologize, maybe this is sexist, but I don't think for women, but I think for all human beings. It's an illusion. So being more, part of our strategy, our conversation tonight is to help people strategize around finding wellness, how to deal with emotional turmoil. And I would suggest that we find some other carrot, some other, just wellness, health for the moment, because life is very volatile.
You're a robot if you're always balanced. If you have a scale of 1 to 10, and 1 being as depressed as you can be, and 10 being as manic and energized as you can be, and 10 is bad because you could probably be in a mental institution. At that point, psychotic. 5 is like the balance, right? It's like a robot. And we're not there. We're always vacillating on that, from morning to night to afternoon to day to week. Somebody could die in our family. We're down to a 2. We're up to it. Get pulled over by a cop. You're down. You have a great day at work. You're up. You're always constantly going up and down. So you're right. There's no balance. Everybody vacillates on that scale, and it's about how do we manage each number appropriately for ourselves, and not flounder and fail. So how do you manage the 3, the 4, the 5, the 6, the 7 appropriately? Because we are all that. We're never balanced.
Yeah, and knowing that these vicissitudes are normal. They're human.
Yes.
And particularly for folks who identify as women, we spend many, many years in cycles, and our biology in some ways prepares us for those vicissitudes, because it's a constant dance that changes not only month to month, but year to year, and et cetera. Yeah.
There's definitely different challenges with different sexes, for sure. What else? What do you got on your mind? Who's got something on their mind? All right, so let me ask the question. On a college campus, how are you dealing with, the students obviously watch the news. You have students at Vassar from all over the world. What is that dynamic like? What are people thinking about, this country? What are, when the COVID happened, was it before COVID? It was before COVID, in the beginning of President Trump's first term. He basically put a ban on travel for certain populations, and many of those people were away on break from school, and they were supposed to come back to universities throughout the United States, right? And they couldn't come back. So, there's a big impact on a college. Vassar's a little different than a Marist or a Mount St. Mary College, or you have people from all over the world. So what kind of things are you hearing from all of those students?
Yeah, the full range, as you can imagine, of reactions and feelings. We're a community at Vassar where people really care about each other and care about each other's wellness and safety. Not only at Vassar, but care about the wellness and safety of communities all around the country and the world. It's a community of people who deeply care and are very committed and really passionate about helping people to feel safe and well. So I think it's just a very heavy time when you have people who care and are very compassionate to these issues. They feel very impacted by them. And for each other, right? We hold students with identities and from all nationalities, from all identities, who they and their families are being personally impacted. And it's a really interesting moment because they're holding a very heavy weight of that, and yet trying to keep up with the demands of being in a very competitive, academic environment. You can only imagine how challenging that is for them. So that's when I talked about the compartmentalizing, but they're trying to get their work done and focus, while also being worried about their family and their friends. I think the college is trying to make space for them to talk about the reactions and their feelings they're having, to normalize that. They're helping them to have access to resources to learn as much as they can. As an example, they're bringing, I'm forgetting the name, but from Pace University, there's a justice group that they're bringing to campus where people can meet to just talk about immigration and to be educated so that they know how to take care of themselves and their family members. And there's some decisions people are having to make, hard choices, thinking about being away from your family for a year and looking forward every year to the summer where you get to go back to your community and your culture and see your family. And knowing if you do that, you might not be able to return to school. So having to make the choice of whether you should stay on campus for the summer and just not see your family for another year. Those are the kind of decisions. And worrying about their visas being revoked, worrying about being sent back, worrying about whether it's safe for them to speak to the things that they're seeing in the world. We're trying to help inspire people to be leaders, to help our country continue to grow and learn, and they're wanting to use their voices, and they're trying to figure out, can they do that safely? So it's a lot, and these are 18 to 22-year-olds primarily. That is a lot for them to be carrying on their shoulders. And fortunately, again, having the community to help support each other, and then having some of us older folks around to be able to support too. I think it makes a huge difference in people's mental health to feel like they're not alone and to feel like we're sort of in this together.
I was just going to tag on to that, when I think about being 18 or 20 or 22, it's such a heavy burden. But I think we'd also agree that, in a way, this kind of intersectionality of psychosocial, biology, economic, racial, gender, there's just all of these things are coming into play. They always have, but they're being highlighted now because people are being ridiculed and sent to jail and silenced in so many ways. So, us adults in the room, we're all feeling, in a way, the heaviness of it too.
Oh, for sure.
Yeah, yeah.
Cultural competency, I think, is a very important, and I'd like to hear from the panel about why they think it's important, but I think it's very important, and unfortunately, it falls within the diversity, equity, and inclusion framework, and I can speak from a not-for-profit agency leader. It's a little scary because we had to wipe stuff off of our website. We couldn't talk about it. We couldn't highlight it. It's the opposite of freedom of speech, frankly. Money is actually being withheld if that stuff is out there, being pushed. So cultural competency, we've come a long way, I think, in trying to understand different cultures, different backgrounds, different genders, what the struggles might be, how they're different than your struggles as whoever you are, and why it's so important. And I think a better understanding of the people that we're dealing with and talking to, our friends, our neighbors, our clients, we really have to have a better understanding of what they might be struggling with. So we can't let that be silenced, but how important is that for Eric?
Oh, I'm sorry, Andrew. I want to add a little quick about the you're talking about. So, right here in my current job, Mental Health America, I have seen that's a vulnerable group. It's a wider gap in the system. You know what I mean? Because those groups don't have a connection with the resource around the community. So I believe it's part in the role of psychology, social worker, reduce that gap. That's like a bridge. And that was why I feel fortunate to be part of this great agency, because I have seen my coworkers, I have seen my supervisors in different levels. So they are really committed with the community. And we never close the door behind us. You know what I mean? It's something you look, is sick as hell, we figure out. So where maybe we can help you, but somebody else.
We'll make sure somebody.
Yes, it is.
Yes.
Yeah.
Yeah. Well, I paid him to say that.
One of the things that I have found very interesting about the whole kind of cutting out of DEI, oh no, we said the bad word, is one of the things that I do with Dutchess Pride Center is I go into different organizations and schools and nonprofits, and I provide education. I do different types of education about how to support your queer clients, or just kind of, there's one I do, it's literally called the ABCs of LGBTQ. And I have gotten so many more requests over the past 2 months than I had probably in the year before that. So I feel like that's almost a way that organizations are like, okay, I'll take this off my website, but I'm still going to have this person come in and do this education and teach my staff and teach my, the people how to be supportive. So it's been very interesting to me to see that was not something I expected when kind of I heard about all this, remove DEI. I was like, oh, well, there goes that. I'm never going to be invited anywhere ever again. But it has really been a huge increase in people requesting that I come and I do this education. So that's a positive. Yay.
It is a very positive. That makes me feel really good to hear that.
Yeah.
That's great. Amy, how you doing?
I'm great. How are you? How's your voice holding up?
It's not. So what about in the world that you work in? Is cultural competency something that ever gets played? Probably not in private practice because you're not mandated to do it, but you focus on cultural and understanding people's different backgrounds and cultures. Why is that so important?
You can't begin to help someone seek health and wellness if you don't understand where they've come from. And it's so much a part of our well-being, our sense of standing strong in the world is the foundation of where we come from. And if your belief system is, pardon me, I'm going to be extreme here, but if your belief system is that if you rattle a bell 3 times around the head and that helps your headache, I'd say rattle that bell. And let's talk about other ways too. And that there's many, many, many ways to find health. Cultural competency was something that when I was in corporate medicine, certainly there was time spent educating people about it. There's a lot of lip service. They have a big checklist of we will do this, do this, do this,
Take
do
this test, take
exactly.
that test.
But on a personal level, it's part of what makes what I do so interesting too. When you're talking to an individual and you want to know about who she is and what her fears are and concerns are, you gotta know where she's coming from and the pressure she's faced, and to some degree assuming that there's trauma in most women's lives, and so being mindful of that and sensitive about that, so being transparent and thorough and safe and all those things to help women share their stories with you, because that's how you learn about them, and that's how you help them move forward in mind and body.
This is a little bit of an aside, but since I have you here as a medical doctor, and focusing on women's health, if a woman is struggling with depression, for instance, or anxiety, but mainly depression, there could be physical reasons for that. I always say, go to your medical doctor first, rule out the medical, reason for it. What are some of the main things that you see that could be fixed on the medical side, maybe with medication or without needing to go to a therapist or a psychiatrist? I wouldn't say take psychiatric medication and before you did that rule out with a medical doctor that especially focuses on women's health. So what are some of the things that you would tell the audience watching that they should do? Follow up with their medical doctor and know that it could be X, Y, and Z, and not just depression or not just depression.
Yeah. So I guess my first response is it's never just depression. The mind and body are connected, and when we feel ill in our body, it affects our mood and our emotions, and vice versa. But it's true that there are kind of medical conditions that can increase the risk of a mood disorder or a shift in the way someone's experiencing their own emotional contours. The big one is the perimenopause and menopause. This is a hormonal transitional time where women will often come in and say, well, yeah, I'm having those hot flushes, and yeah, I'm having a change in my menstrual cycle, but I'm also suddenly really sad or really anxious. Anxiety is a huge part of the perimenopause. I've had women who come to see me in Rhinebeck area from Cakes say, I've been coming to see you for years. Crossing that bridge, no problem. All of a sudden, I can barely drive over the bridge. I'm feeling so anxious. And it's usually triggered by this hormonal shift. Thyroid disorder, absolutely. Cancers. Any treatment for a chronic disease is going to change the way in which somebody experiences their emotional, their emotions. And I have seen, though I don't know the science, I don't know that anybody does, somebody will come in and say, I'm just feeling ill at ease, I'm feeling more anxious, or I'm feeling more despondent, and shortly after they're diagnosed with a cancer or diagnosed with some major medical problem. So it's almost as if the mind precedes the somatic, the physical phenomenon or the capacity for us to make those diagnoses. So I would say to anyone who is, kind of suddenly experiencing a change in their mood should certainly ask their clinician, is there something going on that's kind of a medical diagnosis, or a worsening of a known mood disorder. Certainly, there's a role in absolutely looking at both sides. Yeah.
Our minds are incredible. That's very intuitive that we have that.
Yeah, it's very
And to
powerful.
know we can't put our finger on it. We don't know what it is. But
I call it intuition.
It is
and
intuition.
It's a very powerful course director that we often, particularly women, have been told, it's nothing, honey. But I'm here to suggest that we listen to it. All of us. Yeah.
So if I go down a line, what are some interventions, some ideas that you all have that you would give to people that are struggling with either dealing with today's society or just their own struggles internally? What would you say is some of the best things we can do for ourselves?
I think one of the best things is to stay off social media and stop looking at your phone. Even if you have carefully cultivated your Instagram feed to be something that you really love, there's going to be something disturbing on it. So if you're not in a great headspace, stay off social media. As I said earlier, finding ways to find joy in your life, in whatever those ways look like. And I think also just, understanding that you're not alone. There are communities of people who are struggling, and even just not thinking about your own community, but thinking about the other communities. If you are a person of color, thinking about the fact that the queer community is struggling also, and finding almost strength in the fact that there are a lot of people struggling. I wish I knew who to credit this to, but I read this a few years ago, and it's something that I have been revisiting a lot the past couple of months. If you kind of imagine all the isms in the world as this giant tapestry, and you look at this tapestry and you're like, somebody needs to destroy that tapestry, but I can't do it alone. That's too much. It's giant. It's the size of a house. There's no way I'm destroying it. But if I sit there and I pull one of those threads, and you sit there and you pull a thread, and you pull a thread, and every one of us pulls the thread that we are capable of pulling, eventually that entire tapestry gets destroyed. So when you're looking at this as this giant systemic problem, it becomes really overwhelming. But when you think about the ways that you personally can do the things you can do, even if it's something as simple as, I wrote a letter to my congressman or congresswoman or congressperson, and I told them that, this is something I don't agree with, you have tugged on your thread. And some days the thread is going to be too far away and you can't reach it, and that's okay. And some days you're going to be there and you're going to be yanking with all your strength. And that's okay too, to rest. Take those moments where you need to rejuvenate and you need to rest. And because we can't be kind of fighting nonstop. So I guess that's my say.
I think this idea, part of what you're talking about with the thread, I love that, and that's a beautiful metaphor, just beautiful. It makes me think about how do we find ways to have agency, right? Like in this big world where we feel helpless, what are the pathways of meaning and purpose, right? So what are the things that I care about? Who are people who are like-minded about these things that I care about that I can join with to pull our particular thread? Right? Because then we feel less alone. We feel like we're a part of a greater good. We're doing something that lines up. It doesn't mean it's not scary and overwhelming, but somehow it feels more manageable when we're with other people, when we're in it together. It really does make a difference. So that supportive community, I think, is everything, because we sometimes have the urge to withdraw and to hide because it's just too much. Right? So we withdraw into our rooms and we scroll our social media, and that isolation that can happen can really make the mental health concerns worse, right? So even though it's hard, you want to stay in your room. It doesn't mean you can't pause and take time to yourself, but make sure to stay connected to those communities. And what I'd say is in a vulnerable way, right? If we're with people but we're acting like everything's fine and we're fine and all's fine, right? Versus saying, I'm having a hard time, are you having a hard time? Like being real and authentic with each other, I think is really important. I also think mindfulness, we hear that as a buzzword, right? About, I think meditation. What mindfulness really means, how much time do we spend worrying about the future and like thinking about the past, right? Versus being in this moment right here. And the reality is there's nothing we can do to change the past. we definitely can't affect the future right now. What we have control over is like what's right in front of us and how we're responding to it. So if you find your mind starting to spiral, what's happening right here, right now, right in front of me, and what can I do about that right now tends to give us more of a sense of agency. And then I would suggest, to consider counseling as an option. It really, of course, bias coming from a therapist. But, the people who come and see us are not just people who have severe mental health issues. It can be really helpful to be an external processor and talk through things with somebody, right? So, and it doesn't have to be a therapist. It could be a trusted friend, a family member, a spiritual advisor. But therapists are trained to do this, right, and have some strategies. We have mind-body connections and lots of research about techniques that can help access, especially if we're carrying trauma in our bodies, things that we can access that might be hard to access otherwise. So don't hesitate to come and visit us.
I guess the best way to describe what I would suggest is kind of integrative care, is really looking at all of the things that my colleagues here have already mentioned, but also attending to the body, if you will. And what does that look like? Well, it looks like going outdoors. We all spend way too much time in front of a computer, usually indoors. We need to get fresh air. We need to take a walk. We need to move our body. If you can dance and sing every day, it's good for you. It releases oxytocin and endorphins and all these good physiological phenomena. So it's real. It makes us feel good. And even if it's for a moment, it's still something in the face of what feels like an otherwise kind of heavy cloud all the time. So being active, eating well. And I know that sounds so simplistic, but there's so much science that demonstrates that when we eat healthy, we eliminate highly processed foods. We eliminate excess sugar. We have a well-balanced, colorful diet on our plate. It helps us feel good, and we are healthier in that, as a result of it. So I would encourage us as best as we can to eat as well as we are able. And do we all need a chocolate chip cookie every once in a while? You bet. But if it's once in a while and not a regular thing, morning, noon, and night, it's a good thing. I would absolutely encourage people to seek counseling and build community. Again, there's so much science demonstrating the value of community. And I love that social scientists, ethologists, people who study animals are talking about how it's no longer the survival of the fittest, which is all about competition, a very male lens. It's the survival of the how do you say that? Friendliest. And I love that concept that we actually, if you will, survive when we build community, when we support one another, when we find what makes us feel good and celebrate it. It helps us survive. Yeah.
So when I think in a crisis or when a problem, what is the reason why the people come to the therapy? I like imagining always like a iceberg. You know what I mean? Because in the iceberg, in the middle of the ocean, you only see the iceberg peak. The iceberg peak only represents, 10%, 8%, 5%. So, but what is under the water? You know what I mean? So I write some recommendation, but that recommendation is only for the 10%. The only we can see. But definitely we need to go to the therapy if we want some change. And something like you can do it, was the best. I don't think so. This is a good way for get a real change.
Yeah, I would agree. And we've talked about this in another roundtable we had about finding your tribe. And I think that's what you talked about that. And having a group, having a social network And I would also say that if somebody is gravitating toward isolation and staying in the room, and when they're offered an opportunity to do this or this, and they choose this, which is alone in the room again, they got to push themselves to go and try it, push themselves to go out there. They might feel uncomfortable, might be scary, they might not feel up to it, but most of the time, I would say that once they step in the room with their tribe and their friends, the world is a better place. So I try not to isolate as much. I thought we'd open it up to any questions that anybody wants to ask to anybody on the panel. Don't be nervous. Come right on up. You might be able to yell it out, but you could come up to the microphone if you want.
So do I have to say who I am?
You can do anything you want. You can make up a name if you want.
I'm going to not make up a name.
Okay.
Can you guys hear me?
Yes.
Okay. So what I want to say are a couple things. From the very beginning, thank you, everybody. It's been so informative. But what was said was self-care in the beginning. When we started with self-care, I'm Patty Easton is my name. It is so hard to get an appointment with a primary care physician in this area. I have lived out in Rhinebeck for 3 or 4 years. Amy, I had an appointment with you last year, November, because I was trying to switch from Columbia County to Dutchess County. The day of the appointment, I called because I was going to be late, and I was told you had retired, so don't bother coming in, and that they sent letters out and emails to all of your clients. I was a new patient. I didn't get anything.
This is why I left corporate medicine.
But I just want to say, it's not a personal attack. It's frustration.
Yes.
I am now going back up to my Columbia County primary care physician this month because I need to get my medication refilled, and I can't do it without her approval, and she has to see me. I have an appointment next year, 2026, with a new primary care physician in Rhinebeck. I mean, it's absurd.
Thank you. You're bringing up such an important part of the systemic breakdown. And you're not alone. I mean, you know, almost every woman I speak to talks about the lack of access. And the, you know, it's so multifaceted. I could tell you my own story, but it's almost irrelevant. It's because we all have our own stories. But the system is broken. The system is broken, and I don't care where you live, because I have, you know, plenty of friends and family who live in New York City, where there's a large, you know, there's not a dearth of doctors, yet still, either one, you have to pay a lot of money to see them, they don't take your insurance, or that the waiting period is long and difficult. There aren't enough primary care doctors in this country, and that's a whole conversation about how primary care doctors are reimbursed, lack of elevating specialists instead of people taking care of people in the primary. I mean, you're absolutely right. It's really, really difficult from everyone's perspective, except for the CEO of these big companies.
Well, I think the problem for me, I see, is that our healthcare system is not about health.
That's right.
It's about sickness.
That's right.
It's about the profit is being made off people continuing to get sick.
That's right.
So, I mean, I take care of an older couple. They're in their 80s, and he has early Alzheimer's. And I took him just to a foot doctor at Optum in Rhinebeck a couple of weeks ago. He had gone to this foot doctor for years. We walk in, and they had no record of his appointment or him ever having been a patient there. Then we're told that their system has gone down, so they've lost all the data that they had on their system. They were able to get us in, but the doctor seemed to have no memory of ever having seen him, knew nothing. There was no recognition. She said you live alone, and we had to tell the story all over again.
Yeah.
And it's just so frustrating. I mean, I feel like And this is someone who has great medical care. I mean, if you go into a nursing home or anything like that, that's where the people stand in groups and talk and laugh at the patients. And, there's not compassion because everybody's overworked. And the other thing, I just want to wrap it up because I'm just one person who likes to talk. But I lived in New York City during the AIDS crisis. And the motto during that time was silence equals death. And I have a son who's 28, and he graduated from college a few years ago, and he deals with depression and anxiety. And it has been him finding a community of friends that see therapists, that it's okay, and that to understand this is something not, weird that his mother does, but it's something that maybe can help him. And I think the more conversation we can have, especially with boys and men, to make it, we're dealing with our vulnerabilities and we're dealing with the illness, the sickness, and the root of the problem. And that's all I'm going to say.
Thank you for bringing that up. Yeah.
Yeah, it's really tough. I had we don't share all our stories because we all have them, to your point. I had a doctor for 30 years, and that's the greatest thing. You have a doctor and you stay with him and he knows everything about you. And he's part of a big practice and he retires. And then I couldn't get, no other doctor in that practice would see me. I couldn't get it. So it took me forever, and my blood pressure, I ran out of pills. No one would prescribe it. Now my blood pressure went off the roof again. It takes a long time to get that back under. And the practice that he was part of couldn't even accommodate me. It's a broken system for sure. I'm sorry you had that experience, and I'm sure she didn't take it as an attack. She wanted to retire, and she did.
I'm not
she probably
retired.
didn't even know you were right.
I'm not retired, but that's what they told everyone.
Oh, jeez.
Yeah, it's layered.
Oh, boy. Would anybody else like to say anything? Or yes, come on up. Either way, yeah, come on.
Hey, I actually had 2 points I wanted to make. One, you guys were talking about a practitioner that was making meaningful human connection and paying attention to their patients, and that it was just so much more than walking in the door and checking a tick box. I've had an insurance guy for 30 years, and I had an OB for about 25 years. And I will say that both of them had meaningful human connection, and it made such a difference, and it contributed greatly to who I am today. So thank you. The second thing I wanted to actually speak to is that, in the last 4 years, I found myself in a role. I've been coming to these mental health roundtables, and I'm in human resources. And wow, in the last year and a half in this role, the tables have turned. The mental health crisis that's happening right there at my doorstep on a daily basis supersedes all the other stuff. The paperwork and, the payroll, and it's crazy. And, we do due diligence. We offer them pathways, local people that can help them. But what I want to know is, what can we do differently? I want to bring it in. I want to bring someone in. And I love what you were talking about, ABCs, and educating them, my colleagues, even more. Not even just my colleagues, my upper management. Well, start from the top and bring it down. So what can you recommend? Help me.
There are businesses, there are big companies that hire, just like they would hire a line person to do this or that. They add a position, and it's a social worker or a therapist on staff. Give them an office, and they're there just for your staff. I mean, that means an investment that sometimes the big people on top that are bringing the profits don't want to add, but the payoff might be a lot more than the cost. I think it's necessary.
Yeah.
I think that's the stigma being reduced, but it's also a lot more, there's a lot more crisis going on out there. There's a lot more, it's a bigger, things are impacting people in a bigger way now. Finances, the stock market right now. My wife decided to retire 4 months ago. Now she's like, I'm going to be leaving in a month. And I lost like X number of dollars on my 401k. It's a tough time right now for a lot of people, but even before this 4 months, it's been a tough time. But people are getting the message that it's okay, not only to go to therapy, but it's okay to not be okay. And it's okay to share that you're not okay. And I think that's what you're seeing. People sharing that they're not okay.
Yeah.
The next question is, how do you get them to be better? And that's your struggle.
It's such a range, quite honestly. If there was one or two things that were pretty consistent, I'm like, all right, we're going down this path, we got this. But the breadth of this, mental breakdown, suicide, navigating being a caretaker while trying to take care of yourself, it's deep and wide.
I would just say one of the things we've been talking about at Vassar, because we're seeing the same thing, is the importance of case management is how we're thinking about it. So, just for our students, we actually created a case management department on campus where their only role is to figure out how to connect people to what they need. Because that is more than a full-time job, right? Because there are all different financial this, that, and how do you navigate a system, and how do you deal with an insurance company, and how do you, right? And people don't always know and need to be coached through those things. So, if I had my way, most HR departments would have a case manager, at least one, who would be, right? So that then the folks who want to have to deal with payroll, because then they're dealing with crises on top of that and haven't necessarily had even the training to be dealing with the kind of crises that are showing up on their door, right?
And I think that gets easier as your big company gets bigger to have all these other subdivisions. And,
Right.
there's
But if you're
2
small,
people for 200 people, barely, But I appreciate it, so thank you.
Well, you're speaking my language now, because even though I am a therapist, and I do believe it's very important, I built my career at MHA on case management. I came to MHA to build that department. And that intervention, especially for all the clients that we work with in poverty and struggling with the day-to-day, and it doesn't have to be people in poverty. That's why they have life coaches for people who are rich. You need that person to help figure out how to fix this problem and that problem. And I've talked about this before. My wife is dealing with my father-in-law in an assisted living facility, nursing home now. I can't tell you how many times he's gone to the doctor, either would not have remembered what the doctor said, or the doctor didn't send the medication to the pharmacy, or whatever it might be. She's there to fight the fight for him. There's so many people that don't have anybody to fight the fight. And what happens to those people? They're floundering all over the place. Everybody should have a case manager. And I would say that instead of hiring a therapist, she's absolutely right. Hire a case manager.
Can I speak to that a little more?
Yeah.
Hi, thank you so much, everyone. I feel like I've just been doing this the whole time. My name is Cody Gonzalez. I've been in MHA a long time. I'm currently the Director of Children and Family Care Management.
You should get it on the microphone, since this is being filmed. This is on TV. This is going to be at the movies. I need to hear your voice.
So I've been at MHA for about 16 years now. I'm a former clinician too, so I've been on that side of it. Nonprofit sector is a much better fit for me. But as someone who's been kind of in this field, and specifically with care management, case management, same thing. I've been a care manager myself, and I've been in a supervisory role for a couple of different departments now for about 8 or 9 years. The value of care management on so many levels, I can't say enough about it. And a lot of what we see, because we're dealing with children and families, it's one of two things. So it's either families who maybe just moved to the area, families who are just struggling, have so many issues going on that are so legitimate and stressful. They're simply not aware of what the resources are. They don't even know where to start. They don't know what's out here, let alone how to make a referral, who to call. So there's that, and then there's also the other type of family we see a lot of is families who have so many providers involved already, and they can't even keep track of whose role is what, who's doing what, when is this recertification due, when is that appointment, insurance, everything. Care managers are people who can go in and navigate all of that. It's typically a voluntary role. It's free, and we are literally just there to help the families. If you tell us to go away, we'll go away. We're there as long as you want us and need us. And I always say, I wish I had my own care manager, that would be great, just manage all my stuff. And I just think that that's so important. And I think a lot of times, too, people in this field maybe bring a level of personal experience, too. I think the empathy and the reasons that people go into that sort of area of care is to be involved on a more community level. Maybe there's someone who's had involvement with the system themselves, so they understand from a personal standpoint how to navigate benefits. Someone who struggled with mental health or addiction themselves. And just being someone that, when I'm in the thick of something, personally, if I'm struggling, it's hard for me to get out of bed some days or manage an appointment or keep track of everything. And I'm doing pretty well most of the time. So when you look at the families that we work with who deal with kind of just unimaginable situations sometimes, and then you're expecting them to keep up with all their recertifications and Social Security interviews and, probation and mental, care managers can be so elemental because sometimes it's not wanting treatment or needing treatment. It's how do I execute this in the midst of just real, legitimate ongoing mental health, family issues, incarceration, whatever it may be. There's so many things that can make it difficult. And if we can get easier, help that, on a non-clinical level, that's such an important role, I think. So.
There is an app, Noelle just reminded me, there's an app called Pacifer, PACIFYR. Think of it like BetterHelp. You've heard that one where you can get a therapist on your phone. This is above and beyond that. You can get a case manager, you can get a nutritionist, you can get a life coach, you can get a yoga instructor, all the ancillary stuff that can improve your life, all on that app. MHA Duchess is proud to be partnering with them to try to make it to the next level for that app. I'm not pushing it for that reason, but it is the only app I know that you can access all those different areas without downloading an app just for yoga or an app just for this or an app just for that. So
there's counselors on there too, and we offer it at MHA to our staff for free.
Yeah, and
she was asking.
It's like an EAP program, but
it's like EAP on your phone.
Yeah.
Any other? You had a question.
Me?
Yeah.
Yes. I'm not very good at public speaking. But,
Okay.
First of all, I'm sorry, Karen?
Yes.
The LGBTQ, and I'm currently dealing with, I have a 13-year-old granddaughter who is struggling, and it scares me. There's so many different things that are going on out there in the world, and sometimes, though, I feel like that some of the choices that the LGBTQ make can be so extreme that it brings a negative reaction back to them. And I find that's happening with the younger generation as well, as I'm watching to my own granddaughter and also my daughter at the same time. So, what do we do about that? The other thing is Amy, you talked about women and being intuitive. And fortunately for me, I figured this out years ago and finding, for me, there is a balance. And there is staying away from the computer, the telephone. I can go, actually, I went several months without even owning a telephone, even a television for that matter. And you're absolutely right. It's finding the toxins that surround us. And it's not just in food, but, our environments, the people that we're surrounded by. But we have to find that balance in trusting people, that is my challenge. Trust, honesty, and finding people that are not superficial. And I find that having just a few friends, and I'm very grateful for ones that I have found, and I am very fortunate, and it's not scary. It doesn't have to be scary for us out there. So that's all I wanted to share. That's it. But thank you.
Thank you. It brings up a good point. It's family members of of people who are struggling and the challenges you might have.
Yeah, I just want to speak for a minute and talking about the young people. You ask a really, really good question about that. Like, what's up with the young people being so loud and passionate about all these issues, right? And is that causing a backlash in some ways? And so just to speak to that, because we do see that a lot, right? I'm working with college students for a long time. So what I find is that our young adults are really compassionate humans overall, and are really, really paying attention to the way their fellow students or young people are being impacted by things. And the more that they see it, they want to help, right? They want to help, and so they're trying to figure out, how do we get people to pay attention? How do we sort of speak up when there's been silence about some of the things these folks have been dealing with for a long time? How do we help fix this? Right? And these are young people, right? So I don't know if you all remember when you were 18, right? Like trying to figure out, how do I help? How do I make a difference? I feel so passionate about this, right? So what I find are people speaking very loudly about these things because they want to make a change in the world, right? And they want to take the world and kind of shake it and make it better, right? Which is the energy that we need in the world, right? So the tricky piece is, how do you support young folks in not giving up that fight? Because that's a fight for all of us. But how to navigate in the systems in a way that are not going to hurt them, too, is a very hard thing. Because the last thing we want to do is silence their voices. We need their voices. Their voices are going to help us to grow and change. But how do we do that in a way that helps take care of them, too? So I don't know if there are other points.
Yeah, I think, young people today are a lot smarter than we were when we were their age. And I'll give an example. When my son was 13, it was during the 2016 election, and he came home and he told me one day at lunch that him and all the kids, the 8 kids at his lunch table were talking about the election. And I was shocked because I was thinking, okay, when I was 13, I was thinking, I don't know, 2 old white guys. Like, I don't know who they are. I don't know what they stand for. I don't know what their issues are. But he was talking, and they were really talking about, like, why we would support this candidate versus this candidate. So I think that's part of it, is that, we have to really think about young people as having a level of knowledge and experience that we didn't have. It's kind of the blessing and the curse of the internet, right? They have access to so much more information than we did at that time, which is really helpful, and it makes them kind of more knowledgeable about things. One of the other things we do at the Pride Center is we have a youth board. And our youth board, part of the youth board, to be part of it, is they take this 12-hour leadership course. And I created this leadership course, and I made it kind of a mandatory thing for our youth board, because I find that they have a lot of energy and they have a lot of desire to make change in the world, and they really want to do things, and they kind of just start yelling loudly about it. So the goal in this is to teach them how to channel that energy, channel that power, channel that desire into a way to make actual change in the world. And they've done some really amazing things. Some of the kids that have gone through our youth board have done like really incredible things for their communities, just by having that little bit of education to learn how to channel the energy. I think it's great when young people actually take an interest in things and they have a passion about things and they want to make the world a better place. I also think part of it is they look at the generations that have come before them and they're like, y'all really messed this up. Like, we got to fix this, because I don't know what y'all are doing out there, but like, we need to make some good positive change in this world. So I think that that's a big piece of it, is that, young people are really, they look at what's happening and they're like, okay, we need to make this better. There is a certain, you said compassion, but there's a certain level of acceptance that young people have for people who are not the same as them, which is also not something that I think most of us had when we were, 15 years old. It's not something that we were really taught when we were younger, but they just have so much compassion for not only seeing that people are different and understanding that people are different, but actually being interested in investing and wanting to celebrate the differences that we have amongst us, as opposed to just being like, well, I'm I fit this box, so that's the best box, which I think is just such an incredible thing. You can tell I love working with youth, right? Like, I'm obviously passionate about working with young people. But I think that that's a big piece of it, is that, you know, kind of like what you said, like there's just so much desire, and if you don't tell them how to channel that energy, they'll just scream real loud.
Scary time.
Are you
You know.
finding that there's been a lot of funding being cut now, though, for these programs?
Not yet. You know, personally for us, for Dutchess Pride Center, we don't have a lot of federal funding. We have a lot more state and county funding. So at this point, that hasn't been cut. Ask me the same question a year from now, and I may have a very different answer. You know, one of the things that I have said to people who have kind of come to us and been like, are you afraid of losing funding? And I pretty much say, you know, the doors will stay open and the lights will stay on as long as they let me, but beyond that, I have no idea what our programming is going to look like. We provide snacks and meals, basically, for some people. We do work with, you know, food insecure families, and I don't know if we're going to have the funding to buy that food in a couple of months, but for now, I keep buying, you know, the Easy Mac that I can't, beef jerky, I don't know why, I don't like beef jerky, but that I can't keep in stock. But, you know, just there's, you know, I don't know is really the answer. I'm not yet.
Anybody else? Yes, sir.
Thank you. Thank you so much for being here. MHA today seems like it's MHU. It's like going to MH University, because the wealth of information that I've gotten from all these roundtables is really unparalleled. So thank you so much for taking the time. Just to address the overwhelming elephant in the room, you know, this is a generation that survived the Vietnam War, and Ronald Reagan, and Justin Bieber. And I think beyond that, I always, when times get tough, I always go back on an old friend who told me, take any problem in your life and look at it as an opportunity to excel. And I hear that ringing in my head. That's my current mantra. So I'm hoping that helps a couple of folks in the room. The self-care issue is huge. You know, I've never understood why in some mental institutions, the food is horrendous. You could serve good food, you could serve healthy food, and maybe help condition patients to eat better, but between the exercise and just getting outside daily and eating well, I think that really goes a long way, and I think it's one of those simple things that we don't address as much as we should. So thank you so much. Appreciate you being here.
Thank you. That is a good way to end it, unless anybody else has another question. All right, well, thank you all for coming. I really appreciate it. Thank you to the panel.
Thank you to you.
It's great. All right. Sure.